We are going to talk about the bones and structures of the skull. On the anterior view of the skull, the superior bone is the frontal bone. It's separated by the coronal suture from the parietal bones. Above the orbit are the supraorbital foramen. This is where the supraorbital nerves, arteries, and veins go through. On the lateral view, you can see the supraorbital ridge. Within the frontal bone, there are the frontal sinuses, which are paired and open into the middle nasal meatus. Here are the nasal bones, separated by the intranasal suture. The middle part of the skull consists of the maxillary bone. Under the orbits are the infraorbital foramen, which is a passageway for the infraorbital artery, vein, and trigeminal nerve, cranial nerve number 5. Below the piriform aperture of the nasal cavity is the intermaxillary suture. This area here is the alveolar process of the maxilla. Within the nasal cavity, there is the nasal septum, which consists of the perpendicular plate of the ethmoid bone and the vomer bone. Inside are the nasal concha. Here is the middle concha, and then the inferior concha. The superior concha cannot be seen in this view. On the superior part of the skull, we can find the parietal bones. They are divided by the sagittal suture. Posterior is the lambdoidal suture, which divides the parietal bone to the occipital bone. Posterior is the occipital bone. The structures on the occipital bone are the occipital condyles. These help articulate with the first cervical vertebra. The foramen of the occipital bone are the jugular foramen. This is where the glossopharyngeal nerve, cranial nerve number 9, vagus nerve, cranial nerve number 10, and accessory nerve, cranial nerve number 11 pass through. The foramen magnum, which is the largest foramen, has the accessory nerve, cranial nerve number 11. Here is the hypoglossal canal. This is where the hypoglossal nerve, cranial nerve number 12, passes through. Here is the floor of the cranium. This area here is the anterior cranial fossa, the middle cranial fossa, and then the posterior cranial fossa. Anterior cranial fossa is the ethmoid bone. Here is the crista galli, which is a vertical projection dividing a point of attachment for the dura mater, helping secure the brain within the skull. Around the crista galli is a curviform plate, which transmits the olfactory nerve, cranial nerve number 1. On the medial cranial fossa is the sphenoid bone, which is a butterfly-shaped bone. Here is the sella turcica, a saddle-shaped depression, and this is where the pituitary gland sits. Here is the anterior clinoid processes and the posterior clinoid processes. This area here is the lesser wing of the sphenoid. Here is the greater wing of the sphenoid. Inferior to the lesser wing of the sphenoid is the superior orbital fissure. Ocular motor nerve, cranial nerve number 3, trochlear nerve, cranial nerve number 4, the ophthalmic branch of the trigeminal nerve, cranial number 5, abducens nerve, cranial nerve number 6 pass through here. There are 5 foramina that you will need to know. The optic foramen, which has the optic nerve, cranial nerve number 2. Foramen lacerum, the triangular shape. Foramen spinosum, which is the smaller foramina. Foramen ovale, the oval-shaped foramen. which has the mandibular branch of the trigeminal nerve, cranial nerve number 5. Lastly is the foramen rotundum, which has the maxillary branch of the trigeminal nerve, cranial nerve number 5. This is the inferior view of the vomer. In the inferior view of the sphenoid, you can see the inferior orbital fissure. Here are the foramina lacerum, foramina spinosum, foramina ovale, the carotid canal, and the jugular foramen. From the inferior view of the skull, you can see the palatine process of the maxilla. Here is the incisive foramen. This is where the nasopalatine nerve goes through. Medial is the median palatine suture. Separating the maxillary bone to the palatine bone is the transverse palatine suture. And the palatine bone is the greater palatine foramen, which the greater palatine nerve passes through. Posterior to that is the lesser palatine foramen, which is not visible on the skull. Lastly, on the inferior view of the sphenoid is the lateral pterygoid plates, then the medial pterygoid plates. The temporal bone are paired cranial bones that form the lateral walls of the skull in the temporal region and part of the base of the skull in the auricular region. Each temporal bone articulates with the zygomatic, parietal, occipital, sphenoid, and the mandible. Each temporal bone is composed of 3 parts: the squamous, tympanic, and petrous portion. In addition to helping form the brain case, the squamous part of the temporal bone forms the zygomatic process of the temporal bone, which is next to the zygomatic process of the maxilla. The temporozygomatic suture divides it. On the inferior part of the temporal bone is the articular fossa. Anterior to the articular fossa is the articular eminence and postglenoid process. The articular fossa and eminence are parts of the temporal bone that articulate with the mandible at the TMJ. The tympanic part of the temporal bone forms most of the external acoustic meatus, which is a short canal leading to the tympanic cavity. The tympanic part is separated from the petrous part by the petrotympanic fissure, through which the chorda tympana nerve emerges. On the inferior aspect of the petrous portion of the temporal bone and posterior to the external auditory meatus is a large roughened projection called the mastoid process. The mastoid process also serves as the site of attachment for the sternocleidoid mastoid muscle. On the inferior view of the petrous part of the temporal bone, medial to the mastoid process is the mastoid notch. Inferior and medial to the external acoustic meatus is a long pointed bony projection called the styloid process. This structure serves for the attachment of tongue and pharyngeal muscles and ligaments. The stylomastoid foramen carries the 7th cranial nerve, the facial nerve, and is named for the location between the styloid process and mastoid process. From the anterior view, we can see the mental protuberance, the bony prominence of the chin, located inferior to the roots of the mandibular incisors. In the midline is a faint ridge and indicates the mandibular symphysis. Farther posteriorly on the lateral surface of the mandible, usually inferior to the apices of the mandibular first and second premolars, are the mental foramina. The mental foramen allows the entrance of the mental nerve and blood vessels into the mandibular canal. The heavy horizontal part of the lower jaw inferior to the mental foramen is the body of the mandible. Superior to this, the part of the lower jaw that usually contains the roots of the mandibular teeth is the alveolar process of the mandible. On the lateral aspect of the mandible, the stout, flat plate of the ramus extends superiorly and posteriorly from the body of the mandible on each side. The anterior border of the ramus is a thin, sharp margin that terminates in the coronoid process. The main part of the anterior border of the ramus forms a concave forward curve called the coronoid notch. Inferior to the coronoid notch, the anterior border of the ramus becomes the external oblique line, a crest where the ramus joins the body of the mandible. The posterior border of the ramus is thicker and extends from the angle of the mandible, the condylar process, which consists of two parts, the mandibular condyle and the constricted part which supports it, the neck. Between the coronoid process and the condyle is a depression, the mandibular notch, or the sigmoid notch. At the lateral edge of each mandibular alveolar process is a rounded, roughened area, the retromolar triangle. Along each medial surface of the body of the mandible is an internal oblique ridge that becomes the mylohyoid line. The mylohyoid line is the point of attachment of the mylohyoid muscles that form the floor of the mouth. A shallow depression, the sublingual fossa, which contains the sublingual salivary glands, is located superior to the anterior part of the mylohyoid line. Inferior to the posterior part of the mylohyoid line and inferior to the mandible posterior teeth is a deeper depression, the submandibular fossa, which contains the submandibular salivary gland. On the medial surface of the ramus is the mandibular foramen, which is the opening of the mandibular canal. The inferior alveolar nerve and blood vessels exit the mandible through the mandibular foramen after traveling in the mandibular canal. Overhanging the mandibular foramen is a bony spine called the lingula, which serves as an attachment for the sphenomandibular ligament associated with the TMJ. Here is a small groove, the mylohyoid groove. On the medial view inferior to the articular surface of the condyle, on the anterior surface of the neck, is a triangular depression called the pterygoid fovea.